So this is a patient from Kenya. He had an echinococcal cyst, and here you can see that it is a hyperechoic calcified rim. I have seen these before where you can actually see worms moving around inside the cyst. Which of the following is a true hepatic cyst?
Congenital.
Congenital. What's a hydatid disease?
It's aquatic.
A tapeworm.
Yeah, tapeworm.
What's a hematoma?
Also, trauma.
Yeah, it's from trauma, and it can have several types of appearances on it also.
Isoechoic bleed on the liver, I don't know.
Yeah.
Yeah.
I'm sorry?
Was it an isoechoic bleed on the liver?
Yes, it's a bleed on the liver. It could be contained, or it could be due to laceration. Which imaging modality has 95 to 100% accuracy in diagnosing hepatic cysts?
CT. Sonography.
What is the most common occurring polycystic liver disease?
What's the most common?
C.
It would be C. Isolated
right?
polycystic liver. Not every autosomal dominant is from one parent. Autosomal recessive is two parents. With PKD, you may or may not have a liver cyst. What is PCOS?
There's many cysts in the ovary.
This is where we have a ring of pearls around our ovary, and it's not unusual for PCOS that you have cysts in the
ovary,
the liver, and the spleen. Okay, so let's talk about abscesses. So hepatic abscesses usually are due to bacterial or parasitic amoeba infections. Sonography, we can locate it, we can measure it, we can categorize it. The patient will have pain, fever, leukocytosis, which is an elevation of the white blood cells. And we also use sonography to aspirate and do cultures on these bacterial or parasitic infections. A pyogenic abscess, it takes care of about 80% of the hepatic abscesses. So it's the most
E. coli.
Echinacea coli is the most commonly isolated organism. It has something to do with the reticuloendothelial system, where it affects our immune system, and it can cause severe sepsis. Biliary tract disease is the most common source. The biliary obstruction allows bacteria to grow and proliferate and can produce multiple abscesses. So pyogenic bacteria enter the liver via the portal vein or the hepatic artery. So how this happens, the portal vein, we eat. Everything that we eat goes through the stomach, goes through the small bowel, goes through the colon, and then all of those nutrients and everything, and bacteria, and the E. coli can travel up the SMB and join with the portal vein, go into the liver, and then they can hibernate inside the liver.
Mm.
They can make it as far as the gallbladder, and then from there it can also develop abscesses in the liver. A pyogenic abscess, you have fever, leukocytosis. Leukocytosis is what?
Red.
White blood cell.
Condition of the white blood.
The white blood cell.
Elevated white blood cells. Elevated LFT, right upper quadrant pain. What is pleuritic pain? What do you think that is?
Oh, in the lungs. Lungs, there's pain when breathing in the lungs?
Yeah, same with breathing, okay? So, or in hepatomegaly. Because if my diaphragm is trying to push down the liver, and my liver is enlarged because I have an abscess and it's tender, then every time I breathe and the diaphragm moves the liver, it causes pain.
Mm.
Usually they're going to be single or multiple masses. They're usually going to be 1 centimeter or larger. Most of them are going to be in the right lobe. They do have irregular walls. Some of them can be round or ovoid, but most of the time they're all going to be poorly defined. Okay? Internal echo is with heterogeneous because they can have debris, they can have adhesion, or they can have microbubbles. So microbubbles inside the liver, you can actually see where when you move your transducer, it looks like you have a sparkler inside the liver. Pyogenic abscesses are usually going to be less echogenic than the liver parenchyma. You can have distal acoustic enhancement depending upon the amount of fluid that's inside the abscess. So our differential diagnoses are a cyst, a hematoma, a bilioma, a necrotic tumor, econococcal cyst, or a cyst adenoma carcinoma. So here is an abscess. It is full of debris. It does have acoustic enhancement. So that acoustic enhancement was our defining that it is not a solid mass. Anytime you see posterior enhancement, it's mostly cystic. Okay? Here you have a large liver abscess because the patient has cholecystitis. What is cholecystitis?
Cholecystitis of the gallbladder?
Inflammation of the gallbladder?
Mm-hmm.
Yeah, it's the gallbladder and the ducts.
Right.
Okay? A pyogenic abscess. We have a patient here with pain, fever, with a history of diverticulitis, and they found that you have massive blood flow through this abscess. It is heterogeneous. It is complex. You can see fluids layering. So looking at this image, what position do you think the patient is in C?
This patient is decubed.
Not all the way to Q, probably 45 degrees, so it would be an LPO.
Oblique. Oblique.
It's oblique, because if they were to cube, if it was a cube, the layer would be
fluid layering.
Right. Okay. This is what gas looks like. It's hyperechoic. Ultrasound can't penetrate it, and if you move the transducer, you can see that this moves along with it, and it really does look like you have a 4th of July sparkler in there. This type of abscess has a very high mortality rate because of gas inside the biliary system. So this is called a pyogenic liver abscess with gas. An amoebic abscess occurs when the patient is infected with a parasite from contaminated food or water. Blood can carry the parasite via the portal vein from what vessel? What vessel it drains the abdomen? The gut.
IVC.
No. What vessel drain the gut?
What duck is that?
I'm sorry?
I'm sorry, what was the question?
Yeah. What vessel drains the gut?
I don't know. Explain it.
The superior vena cava, the superior mesenteric vein drains the right side. The inferior mesenteric vein drains the left side.
Oh,
Most of
SMV
those
and
drain into the splenic vein, and that makes up the
IMV.
portal vein. Y'all remember that?
Yes.
Okay. As long as those organisms are confined to the GI tract, the patient's asymptomatic. But as soon as that parasite meets the liver, then the abscess will start developing. The patient has radical quadrant pain. They have hepatomegaly, diarrhea, fever, chills. They can have jaundice and black tarry stool. They can have moderate leukocytosis, mild anemia, and elevated LFT. So the amoeba usually affects the right lobe of the liver, mainly because of the portal vein and the right portal vein. So the right portal vein branches into anterior, posterior. The left portal vein drains into medial, lateral. Okay? The more mature masses will become hypoechoic. They contain fewer echoes. They can have smooth walls, and they can demonstrate acoustic enhancement, meaning it will be brighter posterior wall. Here we have a mass that measures the right lower lobe of the liver. It measures 4.5. It is a complex mass. Due to where it is, we don't see distal enhancement because it is up against the glissons capsule and the wall. How do you get a parasitic cyst?
contaminated water and food.
Contaminated food and water. What type of hepatic abscess usually develops when the reticuloendothelial system is compromised? I don't remember. Go back and see. Pyogenic abscess develops when reticuloendothelial system is compromised.
Pyogenics. Abscess.
Pyogenic. Which choice explains why an amoebic abscess is more likely going to affect the right versus the left lobe of the liver?
The A.
A.
A. The superior mesenteric vein primarily feeds the right portal. Okay, y'all want to go ahead and go further since we still have, what time did we finish? We still have one more hour. Okay? Okay, so I haven't gone over this, so I'm going to struggle just like you are. Okay? Schistomyosis. It's a common parasite that affects Africa, Asia, Indonesia, China, Japan, South America, and the Mediterranean. It's contaminated water that immature worms can penetrate the skin and travel through the lymphatic system into the bloodstream into the mesenteric vein. What are the two mesenteric veins?
I have SMV and IMV.
Right and left.
The superior
And the inferior.
mesenteric vein. Okay. The eggs can travel into the intestine and the bladder, and they can migrate up the portal vein to the liver. They can surround themselves into the liver tissue, and you can then the liver can turn fibrotic, and then it can cause periportal fibrosis. Fibrosis means that they become less pliable. Portal hypertension can develop along with cirrhosis if it goes untreated. Okay, clinically, the patient will have portal hypertension. Portal hypertension, the portal vein is greater than 1.3, and you have splenomegaly. You'll have a gastroesophageal varices. Hematemesis is where you have a GI bleed and you throw up blood, and you have ascites. Hepatic function is usually going to be normal until late disease stages. The hepatic surfaces become thick. The portal becomes like a clay pipe stem, because they become less pliable because they have turned fibrotic. And splenomegaly will be there. You could have hepatopedal until the portal vein becomes so fibrotic that you can no longer get blood into the liver, and then you'll have hepatopedal. This is a 30-year-old woman with right back pain, and you can see that this is a transverse image in A, and you can see that it has these linear structures due to fibrosis, and they call that the turtleback sonographic sign.
Turtleback.
Turtleback. So other HIV and AIDS. So anytime a person has HIV, first off, you're going to recognize that the kidneys are going to be hyperechoic to the liver, and as they develop into AIDS, then that infection can spread throughout the lungs, the liver, pancreas, spleen, thyroid, and you'll have a starry sky. So starry sky looks like what?
stars in the sky.
Chronic hepatitis.
Yeah,
Chronic hepatitis. Chronic hepatitis. So the echogenic foci that can develop with AIDS, it can cause the liver to build granulomas and foci that don't have acoustic shadowing. Cytomegalovirus, that's another thing that happens with HIV and AIDS. It's where they have a conglomerate of different viruses that affect the body. One of those is always mononucleosis. So if they're going to do a core biopsy, they do that under ultrasound guidance. Some radiology departments will use CT along with ultrasound, so that way they can get a better idea of how to do that large core biopsy, because you can have other diseases that go along with AIDS, such as fatty liver infiltration, hepatomegaly, hepatitis, lymphoma. You can have non-Hodgkin's lymphoma. You can have a fungus called candidus. You can have cholangitis, where you have biliary obstructive disease, cholecystitis, where you have inflammation of the gallbladder. You can also have Kaposi sarcoma, which it happens on the skin due to AIDS. So here is a picture of an AIDS person, and you can see that they have a starry sky. And here you can see a patient. This is full-blown AIDS, and then this is HIV. You have to be HIV positive before you go into AIDS. Here you have hepatomegaly, and here you have, this is a sarcoma once they did a biopsy, and a sarcoma can, they have like lesions on their skin, and it can attack the internal organs also as a heterogeneous mass. Candidus is a fungal infection. You have a wheal within a wheal. It is a inflammatory process with a central hypoechoic area of necrosis. Necrosis means that the cells inside of the wheal have died. So here you can see micro abscesses, where you have multiple small wheals within wheals. Here's one, here's one, here's one. This happened to a woman that was immunocompromised because of high doses of chemotherapy. This also looks like it's metastatic, and so we cannot tell the difference between metastatic or fungal infection. So we're going to have to just describe it as a heterogeneous liver. Which parasitic or infectious process can occur when immature worms from contaminated water penetrate the skin and travel up the lymphatic?
Schistosomiasis, B.
Exoplasmosis, yeah, B. What term best describes when sonography demonstrates a diffuse pattern of numerous tiny, bright, reflective parenchymal echoes?
Starry skies.
Starry sky. Okay, so we're going to stop here. I know I probably have another 45 minutes or 15 minutes to go. But I feel like I'm just reading it to you and it's not there to you. So I'm going to call it quits here. So I have time to review the material. Did Lauren ever show up? Y'all have any questions for me? No?
If we can have some more like quiz question at the end, it could be interesting. You know, like
More
some
questions at the end?
yeah. If you have
I
some
can do
more,
that.
yeah. So we can.
Yeah, I can do that. Okay, so I'll see y'all tomorrow at 9:45. Okay.
Yes, ma'am.
Right. Thank you, Miss
Okay.
Shepherd.
Bye bye.
Bye bye.